Hi, I'm Jeff Lehman. I want to talk to you a bit about ALC patients in Muskoka, and I want to tell you a story first. When I was at one of the first public meetings about the hospital plan here in Bracebridge, I sat beside a woman who was 92 years old. And she said to me, some point soon, I'm going to have to spend weeks or months in the hospital, and I want that to be in Bracebridge. I don't want to have to go to Huntsville and my family to go to Huntsville to visit me. And I understand that. But the reality is, she shouldn't have to be in the hospital for months in the first place. Here's what's wrong with our system. We have a very high percentage of patients in our hospitals who are alternate level of care, ALC. What that means is they are waiting for the right care environment to move out of the hospital. But either they can't afford that care or there isn't a space available. And that might be long-term care like we have here at the Pines. It might be assisted living, a building with some healthcare services in it. It might simply be going back home, but having those supports at home to be able to live successfully and manage their condition. The reality is, because we don't have enough capacity and people can't afford those care environments, they end up staying in hospital, and our hospital has to plan for more space as a result. So I'm working really hard with our doctors' teams, the Ontario Health team here in Muskoka, and with the hospital to see if we can come up with a plan for more of those care environments. That might mean more long-term care homes. It might mean more assisted living buildings. But we also have to tackle the issue that lots of people simply can't afford the kind of care they need. If we can work together as a community to create those spaces, we won't have to worry about going to another community for care. The care can be available closer to home, outside of the hospital. And that's something that we should aim for as a whole community of Muskoka.